Dear friends, I am back with another issue of COVID Clinic. A question that I have been asked hundreds and thousands of times is, what is the role of hydroxychloroquine? I've been getting letters, emails based on the COVID Clinic and my other talks on hydroxychloroquine. There's been a lot of controversy. So I'll try to give you a panoramic view of what the story about hydroxychloroquine is. But remember one thing, as a patient, you cannot start hydroxychloroquine without actually talking to your doctor, and both you and your doctors agree that you need the drug, plus the drug is safe for you. If you are a healthcare provider, then based on the rules of your country, you can use the drug, again, making sure that you're aware of the side effects. And if needed, you can also go to a doctor, especially if you're not a physician, and get an opinion. And based on the opinion of yours and your physician, you can start hydroxychloroquine. So the hydroxychloroquine story is actually very interesting, and it pertains to a little bit of history, which is important because only then it can be understood, the role. As you know, for COVID-19, there was no treatment. So people tried to see if older medications was effective in COVID. So they landed upon hydroxychloroquine, which is maybe 30 or 40 years old medicine that has been used in rheumatoid arthritis and other immunological disease. It was pretty safe to use, other than the fact that it did cause sudden cardiac death. But remember, rheumatological diseases are rare, and even rarer are those people who are put on hydroxychloroquine. But the situation became different for COVID, because in COVID there are hundreds and millions who are infected, and hundreds and millions might need this drug if it's effective, and thus the death threat due to its side effect, which is sudden cardiac death, may be much more higher, and that's where all the problem arises. So a couple of months back, the history goes like this. A couple of months back, the French showed that hydroxychloroquine works. Hydroxychloroquine has been known to work, but only in vitro study, that is not inside human body, but in the lab against the virus. But the first study, which was done by the French guys, showed that it decreased release of the virus discharges from the nose of patients who are given hydroxychloroquine in consort with azithromycin or by itself. After that, there was a Chinese study which also showed a positive effect. But thereafter, there was a bunch of studies in the US. One was just an observational study which showed extremely negative result. What that meant was people with moderate to severe COVID who had hydroxychloroquine died more often than people with COVID who were not given hydroxychloroquine. There were a couple of other small studies, including those printed in top journals, that showed it did not work. Finally, of late came the Oxford study less than a week back called the Recovery Trial, where they showed hydroxychloroquine doesn't work at all. However, the experience in India seems to be different. Number one, they use smaller dose of the drug, and they have shown that the drug is useful and does bring down COVID, especially in severely sick patients, or in patients who are, or in people who are healthcare workers for prophylaxis. So hydroxychloroquine, all in all, is very controversial, not because that it works or it does not work. We still are to find out. As I said, most of the universal studies all over the world did not show much of an effect with hydroxychloroquine within human body, but did show effect in vitro. However, the Indian data seems to be different, so we do not know what the truth is. But having said that, hydroxychloroquine does have a dangerous side effect, which is called sudden cardiac death, and this may get multiplied when you combine that with azithromycin, which is the combination that people most likely use in clinical practice for treating hospitalized patient. Now, if somebody is hospitalized, the story is different because you are under medical care. You get EKG drawn every time that they require. You may be also on telemetry, which is monitoring your EKG every second. But the same is not true for the common guy sitting at home and taking hydroxychloroquine unguarded not being followed by a medical system. So if you decide to go on hydroxychloroquine, please make sure that you're talking to a doctor, whichever country you may be, and only do that or the doctor's advice. As far as other drugs are concerned, including azithromycin, the rule is the same. Please do not start any of these drugs without actually talking to a physician and making a decision along with him what is the best for you. Thanks for now. We'll keep you updated. Don't hesitate to write back to us. Talk to you guys again. Bye.